Hi guys, this is Rares Cojocaru.
And this is Daniela.
And
I'm Howard.
So is it rolling? Is mom all okay?
Yes.
Perfect. Okay guys, so just an update. I'm editing the video right now and I realized that one camera was not filming for like 20 minutes. It happens. So what I'm asking you, please bear with us. Howard Gluckman is great. So we just have one camera on him, and after 20 minutes the second camera with me and Daniela and everything wide angle. Thank you. It happens, and that's it. Back to the video. It is a huge honor to have, I think, one of the most influential dentists in.
I wouldn't say that.
The coolest person alive, according to Dr. Stanley.
We started this idea that my colleagues back home really need some people to look up to, and to find some role models they can follow after they graduate, because nowadays it's such important to have someone who you can trust, both in a clinical side of you and both in a human side of you. And
more importantly,
thank you so much. I knew that you were so good in what you're doing clinically, and today I was lucky to see that discover that you're a good human being, and very appreciated for this.
thank you. And I've done my job.
Yeah. So about this dentistry, how did you decide that you want to be a dentist? How do you remember that?
Well, I actually wanted to be a vet.
Really?
Yes, because I love animals. Animals are my first passion. I have 7 animals in my house. I have 4 cats and 3 dogs.
Oh my gosh.
Yeah, so they were my first passion. But in South Africa, my marks were not good enough, so I couldn't get in. So my friend, I said to my friend, "What are you going to do?" He says, "I'm going to do dentistry." So I said, "Yeah, okay, that sounds good. I'll do dentistry as well." I mean, it wasn't as simple as that, because it had 2 things that I enjoy. I enjoy working with my hands a lot. One of my passions is woodwork. I make furniture in my spare time. And the other thing that I like doing is I really enjoy working with people. I love the interaction of my patients, and I love teaching. So the 2 things kind of married well. So it was a good choice.
So how was it like? You studied in South Africa?
Yes.
How was it like growing up and studying in South Africa?
It was pretty cool. I think growing up in South Africa, it was a bit weird because I grew up in a very bad time in South Africa under apartheid. And, growing up, you don't really realize the suffering that others were going through. Getting to university for the first time, university was the first time we started to see political activism. Because you're pretty, as a white person in South Africa, we were very kind of controlled, and what we were fed by the media. It was a very unusual type situation. You kind of don't really see the forest for the trees. And getting to university was the first time you start to see political activism and watch the police come on and beat up protesters, and watching people getting tear gassed and beaten and thing was quite a powerful image. And so it was interesting, but I think it was interesting for me. It certainly was a formative thing for me to I'm not a major political activist, although I would say I'm a major humanist. Is one of my strongest things. You know what I mean? So that was quite powerful. Obviously, from the other side, there's the fun side that every student enjoys, of going out drinking and enjoying. And we had a great camaraderie with our students, with our group and our student body. And I'm still in contact with a lot of the guys that I was at university and the girls that I was at university with. And then obviously I specialized another 4 years in perio and oral medicine at another university in Cape Town. And that just, when I got into that, it was just passion. I just loved it. I loved everything that I did. It was just like I couldn't get enough. They couldn't get me out of the clinic. I did probably the first bone block, the first sinus lift in university. You know what I mean? It was you know what I mean, it was just I pushed as hard as I could.
Why? When did this passion for perio start, or why not endo or something else?
It's like watching paint dry. Put it this way, I always enjoyed the perio side from university. When I was an undergraduate, I had very cool perio professors, and I enjoyed the oral medicine and perio side of it. So I always kind of knew that was where I was going to go. And I was very lucky because when I first came out and worked as a general practitioner, I went into practice with a guy who was pretty much a guru in implantology way back in the 1990s. So in those days, it was really early days of implantology, and yet he had 10 to 15 years of experience. So, you know, I always say to young people, you know, where you end up is how you're going to practice. So if you end up in a really cheap, crappy practice, the chances that you take on that cheap, crappy dentist role is fairly high. And if you land up in a practice where they're pushing the envelope and you are motivated, that's the role you'll take. And obviously there's also outliers who can do it themselves, and you know it's not a broad rule. But I was very lucky because the guy that I worked for was an incredibly passionate guy, and he motivated me so much. He was always like, you know, I could go into his office and say, what do you think? You know, I'm like thinking all the time, what do you think about this? And you know, you could get a guy that says, listen, don't waste your time, shut up, go out. And he was never like that. He would always sit down and say, that's a fantastic idea, how do you think we can do this, what do you think about this, and let's get started. And I mean, most of the things fell to nothing, you know what I mean, but you know, one or two things, like I wrote a training manual for our staff, you know, for our assisting staff and things like that. And so there was a lot of stuff like that, and he was just great. And I think
awesome.
Yeah, he kind of helped me. And just getting into implantology, then I knew that I wanted to do perio. I knew I wanted to do implants.
So let's say after you finished school, you found this help from the doctor. He was like he was basically your first, let's say, tutor or mentor in dentistry?
Without a doubt. I mean, obviously you get your guys at university, but he was a guy that really inspired me. You know what I mean? He was like one of those guys, and you said, you know, you want to look for people to inspire you, and he was just, I suppose he was that guy that inspired me. Really, it was just fantastic. You know, I used to sit and watch him with like my mouth gaping open.
He was like your Obi-Wan Kenobi.
Yeah, 100%.
Jedi Master.
Yeah, and the nice thing about it is that it was one of the top practices in Cape Town, and there were other guys there that were doing really great endo, really great cosmetic stuff, so I really had the opportunity to learn from really cool people.
That's nice.
Yeah.
Awesome.
And thinking about students or young doctors who want to get into implantology, have not been really, let's say, courageous to approach this.
To all of us noobs are out there.
Yeah. Do you have any tips and tricks or advices how should they approach it in a good way this and not make mistakes or big mistakes? Or...
Look, there's no substitute for training.
Yeah.
And there's no doubt that you have to get training. You know, it's not a thing that you can just jump in and read a book and just jump in, or watch a YouTube video and just jump in. It's not the thing that you want to do. My advice, there's Dental XP, which is an online training facility, dentalxp.com, and they do an externship program which is 300 hours of didactic work where you have to literally go through every single lecture, and you have to go from one to the other. You have to get 90% for each lecture. And it really gives you the opportunity to learn from some of the greats around the world in the privacy of your own home. So it's much better, you know, you don't have to go to a place. And that will give you a very good grounding. And then they have obviously the hands-on training and stuff like that, which you can then do afterwards to actually get your certification. And that's a great place to start, because really you're now doing the didactic work, you're getting certification for that work, you're doing it at home, it's not massively expensive, and it's by the top guys around the world. And I think they have really been trailblazers with regards to education, things like that, for people around the world. And I think you can see it because the level of dentistry all around the world is getting better. And that's how I would tell everybody to start. And from there, you can, once you've got your ideas, you can do little courses here and little courses there. And, if you have the ability to go mentor, to be mentored, and there's people around that you can spend time with and that will allow you to, then go and do as much as you can.
Thank you. Do you remember the first implant that you...
I remember... I'll tell you a funny story. The first 5 implants I placed drilling in reverse.
What?
Yeah.
My first implant I placed, do I remember the first one? No, I don't. It was so many years back. It was in 1994.
94?
When I was born?
Yeah, probably when you were born. It was 1994.
I won't say how old I was then.
But I remember, I'll never forget, because another one of my mentors, a very good friend of mine who passed away too young and was without a doubt one of the most brilliant implant perio-prosto specialists, was just a fantastic human being in all aspects. And I just bought this new unit, and we're sitting and he's doing a sinus lift with me, and we're in theatre and I'm drilling, and he says to me, "That thing's in reverse." I said, "No, absolutely rubbish. It's brand new. I've just taken out the box." He says, "No, pass it here." And he takes it and he unscrews the back and he changes the poles of the cables. And as soon as you change the poles, it started spinning in forward. And he said, "You put it anyway." They all worked. And now, funny enough, we do osteoidentification where we actually drill in reverse on purpose.
So basically, you invented.
I was ahead of osteoidentification,
yes,
totally.
Of course.
Yeah. Do you know, we speak nowadays a lot of success. Everything is about success. Everything is pink. Everything is good. But do you remember some mistakes or failures that you had back in the time
I have failures every day. I have failures every week. Anyone that says that they don't have failures and they do everything perfectly is a liar. It's as simple as that. You just have to understand that every day you try and do the best you can.
Yeah.
And some days your best is here, and some days your best is there. For whatever reason, you might just be psychologically down. You might have had a bad night, or just didn't sleep as well as you could, or you're having a fight with your mother or your father or whatever. Shit happens in life. And as a result of that, your mind's just not there. Mm-hmm. So, is there anything bad? Yes, I can remember all my worst cases. I remember as clearly as anything. Have I made big mistakes? Yes. Have I hit nerves? Yes, I've hit nerves. Have I done stupid things? Yes, I've done stupid things. Luckily enough, nothing's landed me in litigation. Some of them were just things that I did wrong, and were mostly, I would say, treatment planning. And other stuff where you just kind of push the envelope a little bit too hard, and I am a hard pusher. I push very hard, and we're always trying to be creative and create and do new things and try new stuff and things like that. So you kind of are a little bit susceptible to making mistakes at times, but it's the reality of what we do. I think the one thing that is really cool now is the planning mechanisms that we have, which in my day we didn't have. We didn't have CBCT, we didn't have anything guided, we had nothing like that, and there was a lot of guessing. And I'm actually surprised we didn't make more mistakes. You know what I mean? Because you really had to rely on your intuition, your intelligence, your understanding of anatomy, and put a 2-dimensional picture into a 3-dimensional, brain, and still get it, and not hitting nerves when we could have, and things like that was great. But so I think that's taken a lot of our stress away, and I think for younger people who will really kind of develop into something in such a big way, and who are more computer literate than the older guys. You know what I mean? I mean, I'm fairly computer literate, but my kids and their little things and our younger kids, Jackie's younger kids. I mean, they brought up. They're learning coding at this age they're doing coding. They're doing robotics. These are crazy things that They don't even know what a CD looks like. What's a DVD? They've never seen one. So I think for them that they will naturally get into that thing, and it's just going to be such an easy transition into the new age of dentistry, which is, it's thrilling, it's fascinating, it's exciting, I mean, I'm learning a lot of digital stuff now because I haven't done a lot of digital stuff, and I just love it. It's just so amazing to learn new stuff.
So talking about those failures, let's face it, yeah. Did you ever hit the moment when you were like, screw it, and not talking about implants, of course, like, I don't want to do this anymore, I want to do something else?
No, never.
Uh-huh.
Never, ever, ever. No. Not once.
Nice.
Not once, yeah.
That's
No.
passion over there.
Yeah, listen, I love my job. I love everything I do. I love surgery. I love teaching. I love traveling. I love meeting new people. I like making friends. It is, without a doubt, the most special, spectacular thing you could do in life. You know what I mean? And I don't think it really matters what you do. You know, it's not whatever you do it with passion. You know, have passion for what you do, because if you don't have passion, shit, then you might as well die. You know what I mean? Or go drink yourself into a bottle. But it's really cool. It's just, sure, I feel lucky every day. Just to be here, you're lucky. You know what I mean? Just to be with your buddies and, you know, meet new people and get out of your work. You know what I mean? I love my work, but I get like, you know, after a month of not traveling, I'm like, I need to get out. You know what I mean? I want to go travel. I want to go see. I want to go, you know, experience and have fun and have a party at night and, you know, just, you know, lecture and things like that.
So, do you recall any particular moment, let's say, when you thought for yourself, well, this dentistry, I want to be exceptional in it. I
always knew I wanted to be exceptional. For me, it was never a, you know, I think it certainly was once I got into the outside world. Maybe not at university, because maybe at university, you know, you're kind of still drinking yourself. You know, you're still drinking and things like that. But once you get out and you start to go to, I would probably say it's probably the first conference you go to where you see excellence. You know what I mean? And you look at stuff and you think to yourself, my God, that is spectacular. How did they do that?
Yeah.
And when I knew that, it just, you know, I get like a burning ache. If I see somebody doing something so well, I want to do it so well. You know what I mean? And I don't want to do it so well because I'm jealous of them. I want to do it so well because I want to be as good. I want to be the best I can.
Yeah, I know that feeling.
So, you told us about your first mentor, let's say, who influenced you a lot in the career. Could you tell us, like, let's say, three people that influenced you over the career, and maybe our friends could follow them as well in dentistry?
Look, I think in my early career, you know, in your early career, most of the people were the local people around me. The guy that I worked for, my best friend who passed away at 49 years old, he was a massive mentor. My professor, who was a huge mentor for me. But if I take it to the next level, and you start to look at who's out there and who your mentors are, and you know, your mentors change all the time, because a lot of times what happens with mentors is that you get to a certain level and then you actually pass them. You know what I mean? So
Amen.
Yeah, absolutely, and I think it's a great thing, and I look forward to my students passing me. I think it's a wonderful experience to watch people that you can teach. I would be so proud, you know, to watch them come and watch them grow.
That's such a valuable thing to say.
But it's cool. It is cool.
Thank you for saying that.
It is the coolest thing in the world. And I have a student now who's my writer, Jonathan, and I think within a year or two he's going to surpass me, and I can't wait. It's going to be fantastic to see. But saying that, you know, the most influential people in my life are, without a doubt, Howard Gluckman is without a doubt the best bone surgeon in the world, and just spectacular in every way. And I don't think I could ever get past him. Never, because he's just that special. And I think anyone who's interested in bone augmentation and things like that, I don't see anybody else that comes close to learning that kind of work. And he's just incredible in every way. I think guys like Maurice Salama, who is brilliant at academic work, but I think more brilliant in human being work, because it's wonderful to see a person who has reached that level, and he's like kind of at the God level of dentistry, and yet has the ability to build people up. which is a skill, and unfortunately in our profession it's such a seldom thing because there's so much ego involved in you know what I mean, I'm better, you know what I mean, and it's like it's basically a pissing contest, you know, I can pee higher than you. And he's the one guy where I watch him on a regular basis, and he's always like humble of what he's achieved at his age. He's done phenomenally well, and he just like turns around and he just says, now this guy or this lady is just, you got to see the stuff she does, what a fantastic operator, and this really just does that. And I think that's unique. And it's I like that. So from that point of view, he's taught me a lot of clinical work. You know, obviously when I was becoming a specialist, Maurice, Henry, Team Atlanta were huge. You know, Dennis Tarnow, you know, all those names, Danny Boozer, Urs Belser, you know, there's so many around that one could latch onto and kind of be. But I think it's important that you have different mentors and learn different skills, because a lot of people get stuck in a paradigm and they stick to that paradigm, and then it becomes like, if all you have is a hammer, then everything looks like a nail. Yeah. And I think it was something I tried to put forward in my lecture this morning, is that it's not just one thing that you need to do. You need to learn all the skills. And unfortunately, there's some guys like, you know, they will only do one technique, you know, and that's all they'll do. Like the first lecturer, you know, that's it. This is how I do it. Finished. I don't do any other technique. Where, in actual fact,
they don't apply. They don't. There's not a magic technique that applies to every situation.
That's the point.
Yeah.
You have to choose the right indication for the right patient for the right thing, and then you'll get the right job done. And if you try and apply the same technique to everything, you'll fail more times than you succeed. So it's important to learn to go to Marcus Hertzler and Otto Zur. It's important to go to Zucchelli. It's important to go to Pat Allen, and to see what each one is doing and to take a little bit from their stuff. And I think a lot of stuff that I've developed has always been a bastardization of a little bit of this and a little bit of that, and that makes sense, but that doesn't make sense, and put this together with this, and okay, that all fits. Now my puzzle's complete. Because I also operate in a different way to you, and you will operate in a different way to you. We each have our own skill set that makes you strong at what you do. So from that point of view, if you have your stuff, you will develop your own skill and your own technique and grow in the way that your personality and your skill set takes you, and it'll be different to mine.
Thank you so much for that. And I think now you become, I don't know, for me and for Daniel, 100% a mentor, a very good mentor. I know you have.
It would be an honor for me to be your mentor. And there's nothing I like.
I personally follow you on Facebook religiously and read all the comments.
Thank you.
So I know now you have.
Sometimes my comments aren't so polite.
It's fine. You're, yeah, I know what you're talking about.
But you have students now in South Africa, am I right?
Yes, well, we run an academy in South Africa. We run about 10 to 12 courses a year, from basic to advanced to intermediate to everything like that. We do 2-day courses, we do advanced courses, which are 3-day courses. And so we do all that kind of stuff. We do cadaver courses as well, where you can come and operate on fresh cadavers. And we're also looking to, with Dental XP, we're looking to open in the University of Sarajevo.
Oh,
interesting. We're looking to do a live patient course, which hopefully, if everything goes together, will happen next year, and I will be the program coordinator.
Nice. That's pretty close from here.
Yeah, absolutely, which is great, because we do it already in Brazil with Dental XP, which I'm honored to be one of the senior lecturers there. And then this will be something very similar, and it'll develop into something where we can actually do, like say, week courses where it's 3 days lectures, 2 days operations, things like that. And I tell you, the kind of experience that you'll get operating, it'll be like you've never had before. You know, it's like all on 6 bilateral sinus lifts, bone blocks, you know, whatever advanced work you can think of, socket shield, root submergence, whatever, you can do it.
Do you think are these lessons that you make aimed also for young graduate students?
Yes, they are. They for everybody. You know, and unfortunately, sometimes even some of the older graduates who think that they have got it just by the grandfather clause need to come and understand and learn what the newer technology is about. What are our parameters? They don't know. So it's for everybody. and I think everybody who comes will find something. And you know, you learn everything at every lecture. Every lecture you go to, you'll learn something. Sometimes it's what not to do, and sometimes it's, you know, sometimes you pick up huge amounts of things, you know, really skilled. I mean, Zukeli's lecture this morning, for me, I learned a huge amount, you know, just like little tips and tricks. Although I've been doing it for so many years, I'm like, okay. You know, just like maybe 5 or 6 great points that you take home and say, this is going to make me better. You know what I mean? And sometimes it's overwhelming, especially at the early level. Mm-hmm. But it's like driving a car. You get in the car for the first time and it's like, oh my God, I'm going to kill myself. But slowly but surely you learn to use the gears and the clutch and the steering wheel, and you know what I mean, and everything becomes better, and then you can start doing wheelies and donuts, and you know what I'm saying? It's experience.
Yeah.
Getting more in the, let's say, life part, how does a day of your life looks like? How...
I wake up as late as I can, but luckily enough I work 5 minutes from home. Some days I walk to work,
okay,
and other days I ride my scooter. So I have a Vespa and I ride everywhere on my Vespa.
What color?
It's black. It's a Monte Napoleone. It's a limited edition. It's a GTS 300, because they normally make a GTV.
Okay.
It's a GTV, so it's the classic style GTV, but it's a 300 GTV.
More power.
Yes, it's the most powerful of the Vespas, and I love riding my Vespa.
That's very Italian of you.
Yeah, I like to think I've got Italian genes, but unfortunately I'm South African. Yeah, so I mean, that's what it is, and from there I go to work, and I'll spend pretty much from 8 o'clock till 5:30 at work, and then I'll walk home, or I'll take my Vespa home, and if my fiance's children aren't with us, then we will go to gym and do something like that. If they are with us, then we'll do something with them. My children are much older and are not interested in anything that I do. It's definitely not dentistry. But you know, we'll sit and we'll chat and things like that, and then a lot of times, you know, the evening will be involved in reading and working, preparing, you know. You know, that we're both busy. Both Jackie and myself are very busy. She's an incredibly intelligent woman. She's doing a fantastic course on future studies. She's an attorney. You know, she's a powerhouse and an intellectual, which is just so fantastic for me. And I love reading the news. I'm a passionate news reader. I love international affairs. I probably know more about the American political system than most Americans do, which is not unusual. And I love reading news from everywhere in the world. I'm fascinated by politics. I'm fascinated by current affairs, international affairs. I'm fascinated by war. You know, the way people think and things like that, psychology around things. So, yeah, I mean, I like to read and I like to learn. I watch a lot of YouTube. Yeah.
Do you watch vlogs? Any vloggers? Something
I
like
do.
that?
I watch woodworking vlogs.
Oh, okay.
Yeah, I watch woodworking vlogs. I enjoy woodworking vlogs because then I can learn new techniques in woodwork. Yeah.
Any socket shield in the woodwork environment?
No, not really. But there is some woodwork in the bone grafting. There is, interestingly enough, I've done 1 or 2 cases where I've used classic woodworking techniques. They call dados, and we shape the wood so that you make little grooves in the bone, and the piece of bone then slips in and is stable without a screw.
Wow.
Yeah, so I've documented 2 cases like this, which is quite fantastic.
So you have quite a small atelier, let's say, of wood crafting, and in your home, like a hobby?
No, I have a massive, not a massive, but I've got 3 garages that I use.
Okay.
So it's not small, it's very big.
No, I've got all the equipment that I need, and I love it. I love making furniture.
That's lovely.
Yeah.
I'm going back to books because I was really curious. Do you read books except clinical stuff?
I don't read clinical books. I look at the pictures. To be honest. I'm not a good reader. I pick up from photography. That's the one thing. The second thing, you must understand that books are 5 years out of date when they come. So if you want data and you want references, you need to get new data. You want to know. You want to go and do a literature search. So I read extensively on publications for dentistry. And other than that, I like to read. I like to read a lot of like action novels and thriller novels and things like that. I love to read things about war, the history of war. I'm fascinated by the Vietnam War, by World War II. I'm fascinated by Stalin, by Hitler, by Ho Chi Minh, by the Chinese. I forget his name. The Chinese head of state who was at the same time.
We're going to put a link down below in the description of the video.
Yeah. Yeah. I can't remember his name for a minute. He's so famous. So I'm fascinated by the psychology, like guys like Che Guevara and things like that. What made these people be who they are? What made them do what they do? You know, how do you kill so many people? How do you justify doing that kind of thing? You know, what's the psychology behind a soldier? You know, how does he go into war? How does he come out of war? You know, how do you help yourself? How does the society's thought? I mean, if you look at the Vietnam War and how the soldiers were totally, they were pariahs of the state. I mean, they hated them when they came home. They were spat on. They were, you know, and you go and fight for your country, and suddenly you come back and people treat you like this, and you see your best friends die. Versus now, you look at the soldiers that are coming back from Afghanistan and from Iraq, and they're literally getting heroes. They get standing ovations and things like that. And I'm sure post-traumatic stress, it must have a huge impact on what it did to them. So it's fascinating stuff, and there's lots of interesting things to do. And I like to read a lot of books where I learn. I love learning, and I think I never ever want to stop learning. I do photography as well, so I watch a lot of vlogs and things like that on photography, on doing things like that.
Peter McKinnon?
No.
He's very good.
Really?
Yeah.
I'll have a look. I'll have a look. And maybe I'm already a subscriber on his YouTube channel, because I do a lot.
It's pretty famous.
Is it? Yeah. So I just want to learn as much as I can. It's like interesting. Like you go, history's fascinating. So I'll come here, and we did a tour the other day. We went and did a half-day tour of all the graffiti art.
Oh, really?
Which was fascinating. And at first I'm thinking, okay, fuck it, I really want to print this. And then this woman started giving us really cool information, and she was so keyed up and clued up on the information, and she showed us each one, and my favorite one now is Boxcat. Boxcat. Do you know who Boxcat is?
No, I don't.
Boxcat is the one with the big. Square Cat.
Ah, okay.
Square Cat, not Boxcat. Square Cat. So Square Cat is a guy that does it, and another one that, I mean, it was just special. And then just getting the history of the country and things like that, and you just want to go and read and see, and what's the history, and how did it start, and why this, and what happened during communism, and you know what's the thought of communism, what's the psychology and the understanding, and you know, and she was great because she filled us in with a lot of the psyche behind that, which is fascinating.
Did you visit the People's Palace?
No, I didn't. I mean, it looks beautiful from outside. I'd love to go there, but maybe tomorrow. I believe it's totally empty, and that is sad.
It's not that empty. I mean, they still use it.
Yeah.
But yeah, you should
nice
go.
The history back over it's
very sad.
Yeah. So that kind of stuff is nice, and what they think of Americans, and how you know, just from a communist point of view, American, you know, from young people coming out of communism, that America was hope, and how much it meant to them, and how Americanized this place has become because of that. And yet, America is like, if you look at it on the grand scheme of things, they're a complete failure when it comes. It's like colonialism, you know what I mean? It's like watching the English, how they went and destroyed the world with colonialism, and the Spanish that destroyed South America with their colonialism, and murdered, and it was just murder, mayhem, and slavery. You know, and took everything, you know, whatever they could, they came and they took. You know, so it's just a sad, we're a sad race, the humans.
But there's still hope. I
think there's always hope. I think the nice thing about human beings is that there is our ability to change.
Yeah.
And I think there's definitely enlightenment and consciousness which is starting to become real. I think if you look at America now with Trump in thing, it actually just like you think maybe not.
Yeah.
where the hell did that go wrong? But by the same token, maybe he's just that beacon that's actually forced, because if you look at the energy of the American people against him, how they're mobilizing against him, maybe it was that force of negative that they needed to band together to actually say, hey, this is not what we want, and this is not the kind of world that we're looking for. We want to ban plastics. We want to reduce global warming. We want to take the human footprint out, so that it stops destroying the natural things, so that your children have can go and actually see a fucking rhinoceros.
We had quite some movements in the streets back last year, actually, in Romania and Bucharest. It's like 600,000 people in Romania and Bucharest.
Yeah.
Huge numbers.
Yeah,
it's good that people are still reacting.
I think activism. I think the whole thing of activism. I think they talk about millennials. Millennials being a little bit lazy and not really big activists. But then the Generation X, I think that's coming out is much more proactive and things. And maybe the millennials are not as lazy as they think they are. It's just once you get to a certain level that you're going to start saying, hey, enough is enough. And the old guard, it's time for the old guard to go, because they have really destroyed the world. We need young, energetic people that see the future and see a clean future and a positive future, not one that's run by corporations and where everything's ruled by money and greed, and there's compassion and kindness.
We have some let's say standard questions. Dania, do you want to go through them?
The boring ones?
In code month. Because I think they're quite nice. What are you appreciate? What do you appreciate in life? Let's say, what do you some core values that you appreciate?
What core values do I appreciate? I appreciate intelligence. Most importantly, I appreciate kindness, and I appreciate compassion and empathy. I think if you've got kindness, compassion, and empathy, you already, whether you have intelligence or not, you are a great person. That's for me the most important. I think integrity, honesty, ethics, and just to, I'm an atheist, but just to treat your fellow human being the way you want to be treated, and to treat the person that sweeps your streets the same way that you treat your professor is so key. And I make my children make sandwiches for homeless people. If they want something, they I want a new iPhone. You can have a new iPhone, no problem. But you go and buy the sandwiches, you go and buy the bread, you spend the afternoon making the sandwiches, and we'll drive around giving homeless people sandwiches.
That's a lot.
And when you see somebody begging at the street, roll down your window and smile and have a discussion. If you have some money, give it. If you don't have money, just say, hey, how's your day? Sorry, I don't have any money. How are you doing? You know what I mean? Just have respect for human beings, and I think that's key. You don't need anything more than that. If I go to a restaurant with you and you treat the waiter like a piece of shit, that was the last time I will have dinner with you. You know what I mean? Yeah. If you treat the waiter and you just say, hey, how's it going? And it's the same as being a mentor, is that, to talk to your students like they're people, not like I'm not bigger than anybody else. I've just got more experience. That's all. But I'm not better than anybody else. There are 1,000 guys that can operate just as well as I can, and some even better.
Thank you for saying this. Yeah, I think,
that's important. So nothing more. For me, it's a straightforward thing. If you don't have that, you're not worth shit.
So you go back to Cape Town, and you get the opportunity to have this huge billboard placed outside your clinic, let's say. And all of Cape Town goes through that street and can see and read what's on that billboard. What would be a thing that you would write on it, or kind of like a quote or a saying or something?
Wouldn't be about dentistry.
Of course.
Yeah. I think it would be something it would be something like that is meaningful that people might take home. I mean, I'm not a guru that spews sayings, so I can't tell you. But it would be something in the role of human kindness. And from a billboard point of view, I don't know, maybe some people would put up something about their dentistry. I don't like to be put on a pedestal. I really don't. It embarrasses me. And I don't think I'm any better than anybody else. I've got, you know, I had a psychologist that I went to see once, and she told me something really cool and really amazing. She said to me, you know, you're just an ordinary person. Some days you do extraordinary things. But other than that, you're just the same as everybody else. And that stuck with me. And that is really, really true. And then my father once told me something. He said to me, never forget who you meet on the way up, because you never might know who you need on the way down. And so, yeah, live your life that way. You know, treat people with respect, treat people with humanity, and just be a good person. You know, don't be a dick. Simple as that. Can I say that?
No, we're gonna.
Okay, don't be an idiot. Don't be a beep.
We had such a great time with you. Sorry for our emotions. This is our first time when we.
No, it's great. I've enjoyed chatting, and I have to say it kind of makes me quite emotional, because I have very strong feelings about these issues. I have very strong feelings about people that walk over other people. I have very strong feelings about racism. I have very strong feelings about feminism. I have very strong feelings about anyone that would hurt anyone else for any reason. It's just not acceptable. That doesn't mean I'm an angel, because I used to be a very aggressive human being who came from a fairly difficult childhood, and it's taken me many, many years to become a better human being and to lose my aggression and to lose anger. So for me, it's been a long haul. It's been a long road to being that, and it's something I keep to aspire to, something that I teach my children, and they've seen a change. They see how I go and how it's changed, and it's just the most important thing in life.
Thank you so much for sharing this with us.
Yeah.
Pleasure.
Thank you. My faith in humanity is restored after this conversation.
Yeah, not mine isn't.
Thank you so much. If you have any final
great
thoughts
to
you
meet
want
you
to
guys.
share with the people, with the students out there who are looking up to you, and
I just want to say one thing. Don't put people on pedestals, no matter who they are. We are just human beings, as I said, that just sometimes we do extraordinary things. And if you want to aspire to something, aspire to being a good human being. And if you find that the person that is your mentor is not a kind person, take their knowledge and move on. Find somebody that can give you both the knowledge as well as inspire you as a human being.
thank you so much.
I don't think it's so better.
Thank you for your time.
Pleasure.